Good morning. Welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. We are hosting press briefings every other Thursday to address questions and needs in Itasca County related to COVID-19 as shared with us by our community. Today we will discuss the reality of what we know about COVID-19 in our county. Our speakers will discuss why it is so important to prevent spread of the virus. In the spirit of gratitude, we are so grateful for Itasca County residents who are doing their part by staying 6 feet apart, avoiding gatherings, and are wearing their masks. Unfortunately, we know that not everyone is helping us minimize the spread and keeping our healthcare resources available for the most emergent care needs. In Itasca, we have outbreaks related to gatherings, in bars, at weddings, gatherings in homes, and garages for parties. And we really want to acknowledge how hard this is. It is so hard to ask our friends and neighbors to not gather. As humans, we crave interaction and relationships with others. But please know, those on the front lines need you. They need us. They need all of us. Our healthcare and medical providers, our nursing facility staff, our school staff. They're tired. They sacrifice their own health, their family's health, with the jobs they do every day to care for others and keep others safe. Please, when you are making small decisions about gathering or masking, you are doing it for our frontline staff. You're doing it for your neighbor who owns a small business. You are doing it for our children to be able to attend school. Every small decision matters, and you doing your part matters. We are in the midst of hunting season. Thanksgiving is coming. We want our loved ones to be with us at the table next year. So we need to make the hard decisions now to make sure we can celebrate together next year. Again, limit the size of your gathering, wear masks, social distance, use outdoor air with windows for ventilation, or be outside if you can. Use social media or virtual platforms to connect. Things like Zoom and FaceTime. There are even virtual games you can play together when using virtual platforms, even if you're in different locations. And if you do plan to visit others, plan to quarantine for 14 days prior to attending. Testing with negative results isn't necessarily enough to guarantee you don't have COVID, as it is a one point in time test. You could be exposed in the days following the test. Another way to help our healthcare system and to protect your health and the health of your families is by getting a flu shot. Flu peaks toward the new year and into the early parts of spring in northern Minnesota. Now is the time to get your flu shot to build up antibodies prior to the flu season coming on. We have a public clinic today in Itasca County from 1 p.m. to 6 p.m. at the Itasca Resource Center. And tomorrow there will be a public flu clinic at Nashwauk Meets from 11:30 to 1:30. And you can also access flu vaccines from your local pharmacies and your local clinics. Again, we thank you for doing your part to keep Itasca residents healthy. Our speakers today will include Dr. Phil Imholt, family medicine physician, Grand Itasca Clinic and Hospital, Vince Rock, interim health director, Leech Lake Band of Ojibwe, Anna Hussman, COVID survivor, Grand Rapids. And we will also be joined by Jean McDonald, Grand Itasca Clinic and Hospital CEO, for our question and answer portion. We'll start with a situational update in Itasca. In the last 2 weeks, we have identified 414 new COVID positive cases, 241 new cases in the past 7 days, and our overall total as of 8 a.m. this morning is 1,224 COVID cases. We've had 19 deaths. We currently have 14 Itasca County residents in the hospital and 3 actually currently in the ICU. We calculated the 14-day rate of cases per population of 10,000 as of November 8th, and we are at 89.6. With the increase in numbers, the increased amount of school staff who are ill with COVID or are in quarantine, we have had shifts in learning models in our local school districts just this week. It includes a 2-week reset for ISD 318, a 3-week reset for our ISD 316 schools, And considerations are happening in other buildings, in other districts who are currently in hybrid mode. Please check with your local school districts or visit their websites for more information on their learning models. We are grateful for all of our school staff working so hard for our kids. We see you and appreciate you very much. I will now introduce our first speaker, Dr. Phil Imholt, family medicine physician, Grand Itasca Clinic and Hospital.
All right, thank you, Kelly. As she mentioned, I'm Dr. Philip Imholt, family medicine at Grand Itasca. I'm here on behalf of my colleagues to tell you that we as healthcare providers are very frustrated with our community's behavior. The blatant disregard for mask wearing and people gathering with large groups of other people has led to rapid and nearly uncontrollable spread of COVID. Due to the surge in COVID driven by community spread, our hospitals are full, making caring for heart attack, stroke, and trauma is very difficult. Some people want to argue that the COVID numbers do not matter, but I would hope that everybody agrees the hospitalization numbers matter. If you want healthcare providers to help you, your grandmother, your uncle, your child, or your friends when they need any kind of care, now is the time to improve your behavior. The time is now to avoid gathering indoors with people outside your household. Take personal responsibility and do your part to bring down the hospitalization numbers. Wearing a mask reduces the spread of COVID. This is a fact. At the clinic and hospital, we wear masks all day long and do not see spread. It works in the schools. We see it work in the community. There are scientific studies showing reduced viral transmission when wearing a mask. You need enough virus exposure to get sick. There's data cited in the New England Journal of Medicine showing if you have less viral exposure, you'll become less ill or not ill at all and less likely to spread to others. We do not have a lot of data about the duration of immunity with COVID, but one study from Vanderbilt and Tennessee showed loss of antibodies to COVID in 58% of their healthcare worker participants at 2 months. These are healthy people. You would think they would have their antibodies longer. So over half of the people lost their antibody immunity at 2 months. That is why there are cases of repeat COVID infections a few months later. If the same people can keep getting ill, this pandemic will keep surging until vaccines roll out. Now we have news that at least one highly effective vaccine will be coming out in the coming months. It is even more clear that we should avoid infection and wait for immunization rather than adopt a get the virus and get it over with mentality. So as doctors, we are hearing from our patients that COVID is not a 14-day quarantine and get back to life as we know it. I've had patients with severe cough for several weeks and there's no treatment that will help them. Others have not regained their taste or smell. Even a mild case of COVID could cause potential permanent nerve and heart damage. These are some of the reasons why we recommend distancing and masking. Please respect the healthcare personnel that care for you and the people you care about, whether it be ill with COVID, needing help from an accident, or care from a heart attack, among other conditions. Healthcare workers and healthcare systems are very overwhelmed right now, and we ask you to show your support for us so we can properly care for you, your friends, and your families. Thank you.
We'll now introduce Vince Rock, Interim Health Director, Leech Lake Band of Ojibwe.
Good morning. Thank you, Dr. Imholt, for your words, and thank you, Kelly, for your words. And I love what you say about being grateful all the time. And that's a key part of the things that we do. A lot of our people here are giving all they got, and there is a lot of need out there. We do understand that in our community and in your community. And we do hope that our communities can work together to help take care of these things. Just my thoughts, kind of rambling, but I just want to say Charles Darwin, he came out with the theory of natural selection and survival of the fittest. And you might think that this is one of those cases, but this is not. What it is there's he stated that there was survival in the coldest sense, nature red in tooth and claw and all that. But what we have here is a community survival. And what we are doing is trying to watch out for each other. And by watching out for each other, this is survival in the warmest sense, meaning that we care and we consider each other. And that consideration is what we need for wearing masks. It doesn't just protect me, it protects you also. I want to relate a story that happened to me as I just graduated from nursing school about 15 years ago. And the first thing I did was I passed my NCLEX, and I was eager to get to work, and I was living down in the cities, and I drove down to Alina there on Chicago Avenue and 24th or 26th. And I was hoping to get a job in the ER or something like that because I had done EMS work before. And it just rained, and there was big puddles everywhere. Puddles when the curve out halfway out to the road. And I pulled in there on Chicago Avenue, and I said, there was a parking meter there, and I had to have some quarters to park there. And I was looking all over. I didn't have any in my tray. I didn't have any in my pockets. I said, oh gosh, I'll just chance it. So I opened the door and stepped into the puddle, and what did I find? I found a roll of quarters right at my feet. And I couldn't believe it. I looked up into the sky and I said, "Miigwech, thank you." And so I thought good things were going to happen here. I might get a job here. So I put the quarters in there, and I walked to the hospital. It was probably a block and a half away, and filled out my forms and all that stuff. And as I came outside, I was all done, and there was an older gentleman. He must have been 75 years old, and he could not make it up the curb. He was trying to get up the curb, and he was making these grunting, squealing noises, like it was a big struggle. And so I walked over there, and I reached out my hand, and then just a deliberate motion, he took that step. And it was so easy, it was really kind of an interesting happening there. So when I got back to my car, I thought about what are all these happenings, these two things that happened to me. I always kind of look up, and ask the Creator, why am I experiencing these things? And the question came, would I rather be lucky or would I rather be deliberate? And that's the same thing we can ask with our masks. Do we want to be lucky or do we want to be deliberate? And I can tell you, I'd like to be lucky sometimes, but if given the choice how I want to live my life, I would rather be deliberate. And it showed me why that day. And deliberate is related to a couple other words too. It's deliberate's related to purposeful, and it's also related to considerate. And being considerate to our community members is what this is all about. We have to be considerate for each other, and go back to that in the warmest sense. This is what we're doing. One more little story. I like to tell I'm a guy that tells stories, and I appreciate facts and figures, but I also sometimes the way to teach is to think of something related. And I was thinking about the movie Black Hawk Down. Kelly, you mentioned how much our people are doing all these things and we're exhausted. And and we know the need out there. And in the movie Black Hawk Down, there were some helicopters that went down, and they sent out a convoy to rescue them. And as they went out there into the to go rescue them, people on the rooftops were shooting at them, and basically cutting them to ribbons. And they kept advancing. And one of the drivers in one of the vehicles became incapacitated, and the CO told another soldier, "Get in and drive." And he goes, "But I'm wounded." And the CO said, "We're all wounded. Get in and drive." So we have to go forward. We are all wounded. I mean, at this time, I've had 3 nurses go down. I've had a provider go down. And it's getting closer. It's swirling closer. And yet we still carry on. There's a lot of need out there in the community. We need food delivered. We need medications delivered. We need people to be seen. We have wound cares to be done. That's our home care team. We keep our clinics open in some fashion. We have 6 satellite clinics. 5 of them are functioning at some level. So we try to keep things open. And today our tribal council is asking us to see what we can do to stem the flow. And I don't know, I'm sure the question of cutting services or those things we'll have to ask. I don't think we can cut services. One of the things that I did, and I just took a sample, it's no way scientific, but I went up to the hospital and I said, give me 10 names of people who had A1Cs done at the beginning of the year. And they did. And I said, now give me those same 10 names now. Okay. Out of those 10, 6 people had raised A1Cs, and 3 of them had not been seen. Only 1 lowered their A1C. It's just a sample, but I'm guessing that other healthcare services are suffering everywhere. So we're quite concerned about taking care of our community, and we need to continue to take care of our community. Just saying that as we plan for the future, we look at the past and we think that, all the things we could have done, okay? Well, that's just minutia now. It's over and done with, what we could have done then. The present, now we have to be deliberate, purposeful, and considerate. That's what we have to be now. Stronger, make a strong plan so we can avoid desperation in the future. So these are the things that we're going to be dealing with in our community. And that's all I got. Thank you very much.
Yes,
Rich.
thank you so much, Vince. We will now hear from Anna Hussman, COVID-19 survivor, Grand Rapids. You are muted.
Thanks, Kelly. I guess, so I'm a local realtor and my husband is a local food distributor, I guess. And so we both have been working through this, and we both are very aware of the precautions that are needed for COVID, and we practice mask wearing and safe distance and hand washing, especially my husband being in our 4 major box stores here in Grand Rapids. And we noticed our symptoms on Halloween. I actually found my husband unconscious on the floor and brought him to the emergency room, and he was tested for COVID because he was complaining of having a horrible headache and feeling dizzy and faint, obviously, and he fainted, which was terrifying. And he ended up testing positive, and I tested on Sunday and tested positive. And it started out with just a headache, which we didn't really think anything of, not really realizing that it could be COVID, I guess. And then came the body aches, fever, chills, sweating, loss of taste and smell, loss of appetite. It was hard for us to eat anything when we couldn't taste it, and we just weren't hungry, and we slept pretty much all day for 4 days straight. Some of the residual effects that we have, I don't have taste or smell still, and I was off quarantine as of the 10th. I'm still experiencing headaches every single day, and I try not to leave the house because I get too tired when I get in the car to drive, and I've had to pull over a few times actually. Being younger adults, we didn't really think that it would affect us in the way that it had. And I think that that's something that a lot of younger people aren't realizing, is that just because we're young and active doesn't mean that it's not gonna knock us down. I think another thing that is helpful is talking about the quarantine times, because a lot of people, I've realized when we contracted it, were asking us questions about, you know, what the quarantine times were and what the, you know, when we contracted it, how many days prior to our first symptom were people potentially able to contract the virus. And I think that that is something that a lot of people are confused about and not aware of. And we have 2 children, and we ended up quarantining them for 14 days. Because that's obviously what the regulations or the recommendations were. And I think a lot of people don't understand that. And I think that's something that is helpful when Dr. Imholt talked about the 14 days, and Kelly, how you talked about how you can get tested one day and be negative and test a few days later and be positive, because a few people in our lives have had that situation where they tested negative and a few days later they had starting symptoms, and now they're positive cases. And they were around all these people not knowing that, thinking they were fine. And I think that's something that we need to be aware of. Some of the things that helped me was the county nurse calling and explaining to us what we need to do and the time frame we need to do it in, and having that email sent to us with kind of like highlighted lines of what will help and the quarantine times. I was able to send that to a lot of people actually, so that they could understand the quarantine guidelines. And I think it starts at home. I think, like, we have kids, and I think it starts with teaching your kids that this isn't a joke and it's serious, and we need to practice good hand washing and mask wearing. And I think the schools and the hospital are doing a great job with, you know, reaching out and informing our community. And I think everyone needs to realize that it can affect anybody, no matter your age, no matter your gender. It doesn't matter, you know. So that's all I have for you. Thank you.
Thank you, Anna. And thank you so much for sharing your story. We will now move to the question and answer portion of our press briefing. We ask that media submit their questions and their organization they work for via chat, and we will ask our panelists to respond. And first question. This is Jennifer at ICTV. District 318 has decided to do a reset that sends children into online learning, but because the reset period is voluntary and is being driven primarily by staffing challenges, not in-school spread, students will still be allowed to participate in school sports and extracurricular activities. Starting Friday, Minnesota's new guidelines limit gatherings to 10 people inside or outside. The state is recommending that indoor gatherings be limited to 3 households, including the host. People in our community are questioning this isn't allowing sports in our district, disregarding the governor's orders. That is a great question, and I was able quickly to reach out to a school official. So from their perspective, the governor's orders are related to social gatherings and where the spread is occurring in Minnesota. They haven't affected gyms. They haven't affected other various organizations that promote physical activity. And so from their perspective at this point, sports are not included in that. And if sports were, they would have been regulated by a sports organization from the state. And Adele Whitefoot, with the 14-day case rate per 10,000 reaching above 50, what advice is public health giving to schools regarding learning models? And what advice is public health giving to districts regarding learning models between Thanksgiving and winter break? And Adele's from Duluth News Tribune. So we do meet with school officials minimally weekly and are in communication even more often than that. We provide data primarily on what is happening in the community, and then anything anecdotal we know about what is contributing to the spread within the last week or two within our county, and that has shifted throughout this pandemic, depending on what's affected. There were times when long-term care was more affected. There were times that significant gatherings in certain areas of the county contributed to more. There were times that work sites were affected. There were times that religious services were affected. So those are some of the pieces we share. And then we discuss what the schools are doing related to what's happening inside the schools. And they have done a really nice job of keeping the spread low within the schools. Unfortunately, what happens outside the buildings does come into the schools, which is when you find teachers, staff quarantining, isolating, as well as children. So as far as learning models, it is up to the schools to make decisions. We are able to just augment that with what we see locally. Between Thanksgiving, yes, this is between hunting season and Thanksgiving, this is a time for gathering in general, and then particularly in northern Minnesota, as we are a destination for hunting, and it's a time when folks come together to enjoy that activity. But we just want you to do it safely. Really, first and foremost, our messaging hasn't necessarily changed, except to really, really think about those small decisions. Is this the time to gather more broadly? Or is it the time to stay within your household, within your family? And you can be in your house and wear a mask. You can be in a vehicle with someone else and wear your mask. There's nothing saying you can't do that. There's nothing saying it's bad to do that. We've done it. We've done it in our house. If someone is here and they're having surgery or have some other health conditions, we've worn masks in our house, and there's nothing wrong with that. Wear your mask, limit the amount of people coming into your home, and assume, this is our key message at this point, assume somebody has it or has been exposed. It doesn't matter if it's your spouse, it doesn't matter if it's your children, it doesn't matter if it's your best friend or someone you don't even know. Just assume somebody has it and has been exposed and could be spreading the virus before they know that they have it. Dan has questions for Anna, which you have the ability to choose to respond to or not. Anna, how old are you and your husband? And then there's a part 2 with Dr. Imholt talking a bit more about the frustration him and his colleagues have with community behavior. Do you see mask wearing getting worse? And what do you think at this point will it take to get people to change their behavior? So we'll start with Anna.
I'm 31 and my husband is 36.
Thank you. And Dr. Imholt, the frustrations you and your colleagues are having, and then do you see the mask wearing get it worse? And what do you think it will take for people to change their behavior?
Great question. So I feel like we've had this opportunity to practice in our healthcare facility. We had a lot of changes from March till now where we're learning a lot more and we're doing a better job ourselves of how to prevent viral spread. And so masks work. We've had all this time for people to practice wearing, like make sure it's over your nose, not just your mouth. And instead, it seems like people are just getting tired of it and lax, and that's part of what is leading to the spread. So when we know something works, but you don't do it correctly, of course, it's not going to work as well. And then I think it's almost a two-way street a little bit. Like if I'm wearing a mask and someone else is wearing a mask, that works much better than it being just one person. And so I think we see issues that way. So I don't know what it'll take to get people to change their behavior. I mean, honestly, I feel like it's taking enough people getting sick and bad things happening, which is really sad. We know how to do this better, but some people just don't seem to care. And I think until they're directly impacted with some loved one or friend who's been adversely affected, they're not going to change. And so, I mean, I'm just doing daily education when I see people in the clinic or when I'm talking to people in the hospital. A lot of them didn't realize how they were going to get sick. You know, they were seeing family and it was fine, but now there's so much in the community that they just wanted to see their grandkids and now they're sick and in the hospital. Or that they're quite elderly and their son or daughter came over and inadvertently brought it along, even though they're middle-aged and the person is in their 90s. So I think it's not become okay to just do our normal stuff anymore, unfortunately.
Thank you. And we are now at 10:31, which is the end for our press briefing. I will respond to any other questions that are in the chat via email directly with whoever has them, or I did put my email in the chat and you can reach out to me directly. Again, we are so grateful for all of you here speaking, for all of our healthcare workers, our school staff. We so appreciate what you're doing. We're appreciating those in the community who are doing their part, and they're encouraging others to do their part as well. Thank you. Please continue to do your part. Wear your mask, avoid gatherings, and please stay safe out there. Thanks, everyone.
At Grand Rapids State Bank, we've been a trusted financial advisor to our customers since 1914. We're local, community bankers who understand what it takes to manage a business through thick and thin. Grand Rapids State Bank, your community bank, serving people throughout the Northland.